The following is a demonstration of a healthcare provider meeting with a non-pregnant adult who is not open to quitting. Notice how the provider works to motivate the patient to consider a quit attempt with the use of the 5 R's: relevance, risks, rewards, roadblocks, and repetition.
So I saw in your questionnaire that you had marked that you smoke, but not every day.
Yes, I smoke, and most days I vape as well.
I also saw that you have been working on incorporating exercising and healthy eating. So it seems like your health is something that's really important to you. I'm sure you know that, quitting smoking and vaping is the best thing that you can do to protect your health.
Yeah, I know. It's been a pretty bad habit for years now.
Had you ever considered quitting?
Honestly, I know that I should, but things are just so stressful right now that I just don't see how there's a possibility of me quitting.
When a patient is not ready to quit, you can continue tobacco cessation counseling by using the 5 R's. Notice how the provider employs motivational interviewing techniques to help the patient move towards readiness to quit.
It sounds like right now is not feeling like the right time for you to quit. And there's a lot of reasons, it sounds like, why you would consider it.
Yeah, exactly. And besides, I do a lot of other healthy things. Like I usually work out 3 times a week, and I've cut out soda from my diet as well.
And that is awesome that you've been able to make those healthy changes. Tell me how smoking fits with some of those healthy changes that you've been making.
I mean, I guess it is kind of weird to go work out and then smoke a few hours later, but I don't know how I feel about quitting.
So you're still kind of wondering whether or not now is the right time. And there's a lot of reasons, you mentioned it feeling kind of weird, why you would want to quit.
I obviously know that smoking can cause cancer and other bad things. And I also get kind of embarrassed in public when my hair smells like smoke. And my family just hates it in general. But I mean, it's how I deal with stress right now. So
it makes sense that, it would be hard to imagine how to handle stress without smoking or vaping, since it's been something that you've been doing, looks like, for a long time. At the same time, your family, talking about your hair, and also your health are reasons that in the future you'd want to quit.
Yeah, for sure. I mean, when I'm not so stressed out, I definitely would like to try and quit for sure.
So had you ever tried to quit smoking or vaping in the past?
Yeah, I have actually tried. The last time I tried to quit, it was cold turkey, and that actually worked for like 2 months, I think.
2 months is an amazing achievement. That's awesome. What were some of the things that you did at that time to help with the stress?
I went on a lot of walks, and I would call my sister.
So maybe, in between now and the next time I see you, you could maybe try doing some of those things, taking a walk, or some of the things you talked about that kind of helped with your stress in the past, instead of smoking a few times. And maybe you can come back and we can talk about it, how that went.
Yeah, I can try to do that.
I'd also like to give you just some information about Quitline NC, since I know today maybe wasn't the day to set a quit date, but you're considering it. Quitline NC is a free service with highly trained quit coaches that can help folks, wherever they are in terms of being interested in quitting. And you can get service 24 hours a day, 7 days a week. And it's via phone, or actually you can do it all through live texting or even online chatting.
Cool. Yeah, this is definitely good information to have for when I'm ready to quit in the future. So thank you.
Visit YouQuitTwoQuit.org for free resources for your practice, including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5 A's and 5 R's in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's YouQuitTwoQuit.org.